And so the typical scenario, we had to give the FDA a clinical type case to get this 510(k) approved. So this would be a person that has sciatic pain, some back pain, but is diagnosed with vertical foraminal stenosis. But like many patients, really does not want a lumbar spine fusion, mainly for two reasons. Doesn't want to lose motion in the spine and would prefer something motion preservation. But also knows that once you go down the route of a lumbar fusion, you may be looking at revision surgeries in the next 5 to 10 years. So our concept is, instead of for vertical foraminal stenosis, can you see my arrow work? Okay. Instead of putting a cage in the disc space and doing an indirect decompression, our concept is a vertebral osteotomy, raising the height of the foramen, but leaving the disc and the joint to continue to move. And the device for that is called a VertiWedge. It has FDA clearance, and it's indicated as a partial vertebral body replacement device under the corpectomy. So it actually has a very good coding, CPT code. In addition to tumor and trauma, which the other VBRs, we got the additional diagnosis of degenerative spine disease. And because the joints move, they allow us to use the terms motion sparing or motion preservation. And again, just for clarity, the device itself doesn't move. It just has to hold the correction of the deformity or the height of the foramen for 12 weeks till it heals. It's really the disc and the joints around it that move. We have a second device. Actually, our advisors, so Pulio is one, and really asked us to please make an interbody device with the same unique mechanism of a staple. So it gives good bilateral fixation in addition to the cages that have a lateral plate. So this is also approved. So we have a non-fusion and a fusion device. And the instruments are the same. So you don't have to use one or the other. You can use both. So many times they'll have a painful disc, but there's deformity above that you'd like to correct instead of a 2, 3, 4 level fusion. So you can, there's no restriction on the number of levels. So you can combine the fusion with the osteotomies or alone. And that's our team. And I think you have our emails, so we'd be happy to discuss it further.